I'm Dr. Phani Madhuri. I'm a senior consultant obstetrics gynecology, fertility medicine and laparoscopic surgery at Kiran Infertility Centre, Koramangala, Apollo Cradle Hospital, Jayanaka, Bengaluru. Of course, sometimes, very rarely, you can become pregnant even when you have intercourse during your periods. Towards the end of the third or fourth day of the periods, especially if you have short cycles, there may be an early ovulation. Sometimes people may ovulate as early as 7th or 8th or 9th day. And the sperm, once it enters into the female genital tract, it may be alive for about 72 hours, sometimes really up to 5 days. And the ovulation that releases the egg may survive for about 24 to 48 hours. So in these rare circumstances, sometimes people who have shorter cycles, who have early ovulation, and if they have intercourse during the menstrual cycle also can become pregnant. This again is a very common question that a lot of people ask us, which is the safest time during the entire menstrual cycle to have sex? There is nothing called a safe time per se, which is absolute, but generally it is considered that the first 10 days and the last 10 days of a 30-day menstrual cycle would be probably safe in terms of not getting pregnant, because the ovulation normally happens between the 10th and 14th day of your menstrual cycle in a 28 to 30 day cycle, and if you have intercourse during the 10th and 20th day, you have the maximum chances to become pregnant. So hence, if you have your intercourse probably unprotected in the first 10 days or in the last 10 days of your period cycle, probably the chances of pregnancy could be low. The day the menstrual cycle starts is called day 1 of the cycle. This again is a very common scenario in our OPD practice, that we see a lot of people with irregular cycles don't even think of a pregnancy when they have a skipped period or probably a delayed period, because they're under this impression that yes, they've had a delayed period because of irregular cycles and not probably because of pregnancy. In fact, we've had a patient who was complete denial that she was pregnant even when we told her that she's pregnant, because she's been having irregular cycles for quite some time now and it's never concerned her. So that is how common it is. Now yes, surprise pregnancies are very common with people with irregular cycles, because you can't very precisely track when you've had an ovulation or when you probably have ended up with an unprotected intercourse during the fertile period. So it is very difficult to distinguish between a fertile and a non-fertile period in patients with irregular cycles, and that's the reason why surprise pregnancies are extremely common in this group. Now, sperm survival in the female reproductive tract varies normally between 3 to 5 days. So once it enters into the female reproductive tract, it can survive anywhere between 3 to 5 days, it is what we normally say. This depends on various factors, that is like whether the patient or whether the female is ovulating, or whether she is having any background health issues like a fever or a chronic illness, or she's got any pelvic infection, or she has any other infections in her general body. So it depends on various factors like that. Generally during the ovulation, when the cervical mucus is very fertile and is very receptive to the sperm, the chances of sperm survival are higher and prolonged. But in the non-fertile period, when the sperm mucus is hostile and if she is having any generalized illness or any local infections, the sperm survival automatically reduces. The sperm survival also depends upon the quality of the sperm. Like if the sperms are healthy sperms and very motile, very active sperms, then chances of survival is a little longer as compared to samples of men where the sperms are very weak, or we call it as severe oligoasthenoterospermia. In these samples, the survival rates of the sperms could be lower. Let's talk about when actually ovulation happens. So if a female is very active, has been eating right, has been, physically active, and right meals, right nutrition, good sleep, and in a generally stress-free environment, she will have a regular 28 to 30 day cycle. And in this kind of a cycle duration, normally the ovulation happens around 10th to 14th day of the cycle. This is called the ovulatory period. Now around this time, the ovulation can happen and the female may get to know that she is ovulating with the help of slight bodily changes, like the discharge can become very transparent and runny like an egg white. So she can also have a slight raise in the body temperature. She can feel there is a slight raise in body temperature. She can also have probably a little excessive sexual drive around this time. She can have a little bit of breast tenderness, She could also probably have cramping and heaviness or dragging pain in the lower abdomen, and very rarely some kind of spotting also can happen during this period. So put together all these symptoms, you can understand when you're ovulating. But it doesn't happen every cycle in a similar pattern the same way in the same woman. So there can be changes cycle wise because of so many hormonal changes that we go through. So, and especially in patients with irregular periods, it's very difficult to track ovulation because of the hormonal changes that they go through, and they may not have all the classical symptoms of ovulation even though they are ovulating. So don't go by the symptoms always. Try to be more alert, and if you're trying for a pregnancy and you really want to track ovulation, a follicular monitoring or a transvaginal ultrasound is an excellent method to track ovulation.